The authors do not have any financial interest in the subject matter of this film. Prevalence of dry eye is rampantly increasing all over the world. It has multiple etiologies, meibomian gland dysfunction being one of the commonest causes of evaporative dry eye. The current treatment modalities of dry eye are not good enough. What new treatment options do we have for evaporative dry eye? Introducing thermal pulsation therapy and intense pulsed light therapy. A novel approach to treat chronic meibomian gland dysfunction. LipiFlow is a revolutionary treatment providing thermal pulsation therapy. How does this machine work? It acts on the blocked meibomian glands in the upper and lower lids. The disposable activators are inserted inside the eye below the upper and lower lid, which provides thermal pulsations. Insulated lid warmer shields the eye from heat and vaults above the cornea to prevent corneal contact. What are the indications of LipiFlow treatment? Meibomian gland dysfunction, poor OSDI score, and when conventional therapy is not effective enough. So what factors determine whether treatment is successful or not? These include an improved tear breakup time, an improved OSDI, more functional meibomian glands, and improved molecular markers. When can this treatment be repeated? It is repeated only if the glands are healthy. However, repeat treatment is not warranted in cases of aqueous deficient dry eye or if the meibomian gland dropout is more than 70%. Here are a few clinical scenarios. In the first case, there is both subjective and objective metric improvement, which shows that the treatment was 100% effective. The second case has only subjective metric improvement with no change in objective metrics, which indicates reduction in inflammation. The third case showed improvement in objective metrics with no change in subjective metrics, indicating improvement in the functioning of meibomian glands. Our fourth scenario shows that there is neither subjective nor objective improvement, which could be due to long-standing disease or mixed variety of dry eye. Introducing the second new modality, Intense Pulsed Light Therapy, IPL, a novel approach to treat intractable dry eye. Let us first take a glance at the etiology of MGD. Eyelid temperature influences physical properties of meibum. At room temperature, the temperature at the eyelids is 33 degrees. Physical properties of meibum is altered in MGD, causing a functional block. Secondly, the abnormal telangiectatic blood vessels seen on eyelids of MGD patients secrete inflammatory molecules that trigger inflammation and dysfunction of the meibomian glands. Thirdly, there is accumulation of dead epithelial cells on the lid margins that clog the orifices of the meibomian glands. But what is it that drives pain in dry eye? First is the pro-nociceptive cytokines, low levels of vitamin D, and high corneal dendritic cell density. Normally, the anti-nociceptive factors are responsible to prevent pain. But in case of an imbalance between the pro and anti-noci factors, there is activation of the pain-mediating channel, which results in depolarization of neurons and results in exaggerated nociception. But what is the novel treatment of dry eye? It is the intense pulsed light therapy. IPL increases the eyelid temperature to 80 to 90 degrees in large vessels and 45 to 70 degrees in small vessels, which liquefies the altered meibum, facilitating its excretion. It thus relieves the functional blockage of the meibomian glands and restores its function, giving symptomatic relief to the patient. Also, it destroys the abnormal erythematous blood vessels, thus reducing the inflammatory mediators and making ocular surface healthy. Finally, it reduces the epithelial turnover and unblocks the meibomian glands. EyeLight is one of the latest available machines which showcases synergistic effect of two technologies. Optimal Power Energy (OPE), which is a new generation IPL, and low-level light therapy, which is used for the first time in MGD treatment. How does the machine work? It is a fully automated machine providing direct and indirect treatment for MGD within a few minutes. OPE is a patented broad light spectrum technology based on a highly customizable software capable of optimizing the stimulation and regeneration of tissue. It optimizes the heat emission, stimulating the meibomian glands to resume normal functionality. It is applied on periorbital and cheekbone areas, triggering stimulation of neurotransmitters that solicit the meibomian glands to produce a higher secretion. The natural lipid flow increases, thus reducing evaporation of tears. Light modulation is a patented photobiomodulation technology, a strong metabolic enhancer that stimulates the production of adenosine triphosphate to increase cellular action. Absolute indications of treatment are chronic MGD and highly symptomatic patients. It is not of much value in aqueous deficient and systemically associated dry eye. In patients undergoing cataract surgery, it helps to provide better quality of life post-operatively by minimizing the nociceptive response. In patients undergoing refractive surgery, it gives better quality of vision post-operatively by improving the tear film optics. The advantages of EyeLight are: it does not require the use of a gel, and the light modulation therapy helps to treat the upper eyelids also simultaneously, unlike conventional IPL therapy. The best candidates for treatment are those who have non-specific ocular discomfort, those working in a low humidity work environment, people who are contact lens users, or those who have heavy computer and smartphone work. This novel treatment modality can now be of great help to the chronic, unhappy dry eye patients and will soon be an integral part of dry eye subspecialty clinic.